All right, looks like we have a really good number of participants, so we're going to get started. Again, I'm Dr. Brittanie Volk. I am with Virta Health and am joined by my colleague and really the expert here today, Dr. Rebecca Adams. We're going to be talking to you about how to make habits that stick. So we thank you for joining us, and just a quick note before we get started, if at any point during the presentation you have a question you would like to ask, you can add it to the chat box. You can even submit your questions anonymously by clicking on the button that says Submit Anonymously, and your name will not be shown. We will get to those questions, both Dr. Adams and myself, at the end of this presentation. So, without further ado, we will get started, and we already have a question, so it's good to know the chat box is working. The question is, will this be recorded and will it be sent to us? Yes, it will be recorded and it will be sent to everyone who registered for this webinar. So thank you for your question. All right, without further ado, here we go. We are from Virta Health. Now, Virta is the leading treatment to reverse type 2 diabetes safely and sustainably without medications or surgery. Again, I mentioned that you can ask questions at any time, but if you think of another question after this webinar has ended, you can email support@virtahealth.com and get your questions answered. Now, today we're going to be talking about what is Virta, how to make sustainable lifestyle change. We'll talk about diabetes reversal with Virta and specific to those lifestyle changes. And then I will walk you through the patient experience so that when you leave here today, you understand how we work with our patients to implement these lifestyle changes. I mentioned again, I'm Dr. Brittanie Volk. I am a registered dietitian and nutrition researcher. I'm on the clinical team here at Virta, and like many of you out there today, have a personal connection with type 2 diabetes. It runs rampant in my family, and I had been studying the impact of nutrition on those with metabolic disease, and just found that it's so impactful to have a treatment that is nutrition-based that can help patients reverse their type 2 diabetes, making Virta and helping to implement our treatment with our patients sort of the perfect place for me to be. So I'm gonna let Dr. Adams introduce herself.
Hi there, I'm Dr. Adams, and I work on the research team at Virta. And I'm also a licensed clinical psychologist. And within clinical psychology, I specialize in health psychology, which means supporting people with chronic illness and health behavior change. And prior to Virta, I actually worked in diabetes at Stanford, part-time as a clinician in the diabetes clinic, and part-time in a research lab, studying ways to improve diabetes management from a psychology perspective.
Excellent. All right. Well, thank you. Now, our mission here at Virta, and you'll see Dr. Adams and I both disappear so that you get a really good quality of the webinar, but we'll come back at the end of this so that it's like we're talking face to face. All right. So our mission at Virta is to reverse type 2 diabetes in 100 million people by the year 2025. And it may sound like a really ambitious goal, but hopefully after we share some of our results as well as how our treatment works, that you will see that these results are possible. Now, what Virta is at a high level, I will explain this later, but what Virta is at a high level is a clinically proven medical nutrition therapy based on years of research, and in fact, decades of research. Now, there's really two main components to our treatment. Virta Reverse, which is what I just explained, the clinically proven nutrition therapy, and Virta Continuous Remote Care. Now, we have a team of licensed Virta physicians and health coaches providing real-time individualized care to each and every patient, but at scale. So picture this, essentially providing a health coach and a provider in the pockets of each of our patients because we make ourselves accessible through technology. Now, we're currently running the largest and longest clinical trial ever published on diabetes reversal. We have a number of peer-reviewed published research papers out there, and most recently from our clinical trial, we're proud to share that the American Diabetes Association has recognized carbohydrate restriction, our medical nutrition therapy specifically, as an option, a first-line therapy option for those with type 2 diabetes. And most notably, they recognize that our treatment is the only one that actually allows patients to get off of medications. Now, a highlight of our clinical trial results, without giving it all away, is at 1 year, patients who completed the study, which was a large number of them, 83%, had tremendous results. 62% of them reversed their type 2 diabetes. And by reversed, I mean that they gained control of their blood sugar below what would diagnose them as having type 2 diabetes, and at the same time got off all diabetes-specific medications. So a really nice side effect too was that they saw an average of 35 pounds of weight loss. And beyond diabetes reversal, patients see lower blood pressure, improvements in heart disease risk factors, reduction in inflammation, improved liver function, better sleep, and more. But as we all know too well, lifestyle change can be hard. And this is where Dr. Adams is going to share with us her expertise in this area.
Okay, so we wanted to start by saying something that all of us already know, right? So making lifestyle changes is really hard. Of course, it's hard in the short term, but for many people, it's even harder in the long term. So many people work really hard to improve their health. Maybe they've lost weight or they've improved their A1C in the short term, only to find that the health improvements diminished over time. So despite their best efforts, they may be back to where they began. And when this happens, I've often heard doctors say things like, oh, my patients just aren't motivated, they just aren't trying hard enough, they just need to try harder. But I don't really think that getting motivated is the problem, because everybody is motivated to live a long and healthy life. That's what we all want. But of course, there can be a lot of roadblocks along the way, but it's doable, right? Long-term lifestyle change is possible with the right skills and support provided to overcome those roadblocks. So I'm just going to talk about a few things that I find most important in setting yourself up to maintain those long-term lifestyle changes. And I'm going to start with, let's see if I can, there we go. I'm going to start with finding your why. So finding your why is one of the most important parts of any lifestyle change. Your why is your main motivator for change and your reason for sticking with lifestyle changes. It's what drives you to take action each day to take care of your health. Your why can evolve and change over time, so it's important to revisit it often, reminding yourself why you're doing what you're doing. So in thinking about finding your why, it's important to distinguish between external and internal motivators. So external motivators are driven by external rewards. Losing weight, lowering your A1C, and getting off diabetes medications are common external motivators that our Virta patients have. So these are great for initiating change, but not always the best in the long term. So for example, if you initially lose weight every week on Virta, you might find yourself motivated to stick with the Virta lifestyle because you feel rewarded by your weight change each week. However, over time, you're likely to lose less and less weight each week until you're simply maintaining your new healthy weight by following the Virta lifestyle plan. So this external motivator has now lessened, and you might find it harder to stay motivated. And so you can see how external motivators might disappear or lose importance over time. But when I'm talking about your why, I'm talking about finding your internal motivators. So internal motivators are driven by personal values, such as a way of being or feeling. They refer to the most important things in our lives, desired aspects of ourselves, or ideals that we aspire to. They don't have a finish line because they're ongoing and deeply meaningful, and therefore help you create lasting changes in your health. So for example, you might be motivated by a drive to feel confident, or you might be motivated by things you want to experience, like fulfilling relationships. If your internal motivator is having enough energy and confidence to walk your grandchildren to school or get back to an old hobby, you'll continue to feel the rewards as long as you stick with your lifestyle plan. So both external and internal motivators can be helpful at times, but for long-term lifestyle change, it's especially important to identify and focus in on your internal motivators, or your why. So if you found your why, now what? Your why, or your internal motivators, help guide goals and daily actions or habits. So a very helpful exercise is to actually map out a long-term goal related to your why. Then pick a shorter term goal, maybe a month away, that will help you achieve your long-term goal. Break that out even further into daily actions you can take to achieve your short-term goal. So here's an example of just one long-term and short-term goal that relates to one of our Virta patients' why. So that's freedom. So one way this patient might attain freedom is to reduce their insulin dose. And in order to do that, they know they need to bring down their blood glucose into their target range pretty consistently. So to get those target blood glucoses, they made a daily plan to eat according to their coach's recommendations. So they connected their daily action to something deeply meaningful to them, to their freedom. To make the daily action most effective, it should honestly be more specific than what we have here. So daily actions or habits in particular need to be very detailed to be most helpful. So let's talk about how to make daily action plans most effective. So here we have some guidelines to make your action plans most effective. So think SMART. So your action plans should be specific and measurable. So you need to be able to answer the question, how do I know if I've completed my action or not completed it? To know, ask yourself questions like, how much do I do? How frequently? When will I do it? Where will I do it? Action-oriented means you take an action to achieve your goal, and you are the one taking it, not someone else. So it should be something that is 100% under your control. Realistic is a big one, and I'm going to expand on that in a moment, but the key here is picking daily actions that are truly realistic and sustainable for you. So while challenging yourself is great, you should set yourself up for success in order to maintain your motivation. And then time-bound means there's a specific time frame. So because plans without specified starting and ending points tend to get pushed aside by other day-to-day tasks. But the other thing is that once you reach your ending point, it gives you a chance to adjust your plan if needed or make a new plan to stay on track. So maybe your plan was too hard or too easy. You can adjust it. Your actions can and should evolve over time as your goals change, but it's a good idea to always have a SMART action plan in place. And so here's an example of a SMART action plan. I will go for a 20-minute walk that's specific, realistic, and action-oriented, once daily, that's measurable, for the next week. That's time-bound. So making sure your daily action plan is SMART will set you up for greater success. Okay, so I talked about being realistic with SMART action plans, and I want to expand a little bit more on just how important being realistic is. So setting realistic expectations for yourself is very important. For instance, everybody experiences roadblocks or has lapses. Everybody. You can expect that you'll slip up sometimes. And when you do, it's very important to treat yourself with kindness. Just forgive yourself and then just focus on getting back on track. Beating yourself up will only make you feel bad, which is just going to make it harder to get back on track. What we find is that people with more unrealistic expectations for themselves actually have a harder time forgiving themselves, so they take longer to get back on track. And then another part of being realistic is about quality of life. So meaning setting goals and making action plans that truly allow you to maintain good quality of life. If you have a plan that won't allow you to do that, it's just not the right plan because it's not going to be sustainable in the long term. At Virta, we take quality of life very seriously. We work with our patients to make plans and goals that will allow them to be both healthy and happy. For example, we help them figure out a meal plan that they actually enjoy and that fits into their life. So when you're making your daily action plans, be sure to come up with a plan that is good for your quality of life. And remember that if you do slip up, it happens to everyone. So just forgive yourself and turn your focus to getting back on track. And then the last thing I want to talk about before I switch gears is support. So there are different types of support, and everyone needs different types at different times. So let me give you some examples of what each of these three kinds of support look like at Virta. The first is informational support, which means helping someone get the information they need. So for example, if a Virta patient has low energy, their coach might provide some tips for what to do to increase their energy. Practical support means helping with day-to-day tasks, like picking up groceries or driving you to an appointment. At Virta, our coaches may help with brainstorming strategies to overcome daily challenges, or how to handle tricky situations, like how to maintain your lifestyle changes on vacation. And then emotional support is just what it sounds like. At Virta, it means providing a welcoming, non-judgmental, and supportive environment. Coaches don't judge patients for their lapses. They understand that lapses happen to everyone and provide a listening ear in times of need. So these are just some examples of these basic types of support. Different people in your social network might be more helpful for one type of support than the other. So maybe your friend is better at running errands for you than listening. The point is that you should ask specifically for the types of support you need, keeping in mind who will be best for providing each kind of support. And then I also wanted to mention that in times of stress, sometimes you do need support from someone outside of your normal social support network, like a therapist or a counselor. What we find is that stress does get in the way of long-term lifestyle change for some people. A simple example is over or under eating while stressed. Everyone goes through hard times and would benefit from extra support at times. So if stress is getting in your way, getting support to manage that stress can help both your stress level and your health goals. Okay, so now that I have shared some of the tools and tips that we use at Virta to help our patients successfully make long-term lifestyle changes, let me share our patients' health outcomes to show you what you can achieve with the right tools and support. So at Virta, our approach to diabetes care is pretty novel. So as Dr. Britt mentioned, we use this technology-enabled continuous remote care model with individualized dietary guidance for carbohydrate restriction. We hypothesized that this approach would improve health for patients with type 2, allowing them to actually reverse hyperglycemia and insulin resistance while removing medications. So we put our treatment to the test in a clinical trial. We enrolled 262 adult volunteers with type 2 diabetes who chose to receive the Virta treatment. And for comparison, we also enrolled 87 adult volunteers who chose to receive usual care for type 2, including appointments with their physicians and consultations with registered dietitians regarding nutrition and lifestyle changes. So fast forward 1 year, and here's a summary of the main outcomes. So when these patients started, they had type 2 for 8 years, had an average A1C of 7.6%, and 88% of them took medication to help control blood glucose. 1 year later, 83% of participants were still in the study. And for those who were still enrolled, A1C declined more than 1 point, and 62% of patients had reversed their diabetes. So as a reminder, what we mean by that is that they've reversed hyperglycemia to a point where A1C is less than 6.5% without the use of diabetes-specific medications, so excluding metformin. And then in addition to improvements in blood glucose, patients also lost 14% of their body weight on average and improved most risk factors for cardiovascular disease. So here we're going to focus in a little bit more on A1C, since A1C is a cornerstone of care in type 2. So participants treated by Virta had their A1C decline 1.4 points on average. And you can see that our usual care group did not have any changes in A1C on average during that time frame. And then insulin resistance, which is measured by something called HOMA-IR, also significantly improved. And these improvements made it necessary to reduce, and in many cases actually eliminate, many glycemic control medications, allowing 62% of patients to achieve an A1C less than 6.5% while taking no medications or only metformin. So at 1 year out, we thought this was a really huge success. 1 year is pretty long, but what was even more exciting than what I've just shared is that they're also really great at 2 years. So at 2 years, 55% of study participants still enrolled had still met that strict criteria for diabetes reversal. 67% of diabetes-specific prescriptions had been discontinued by 2 years, and participants kept the weight they lost off, with an average reduction of 12% of body weight lost. And since we're talking about sustainability today, let's take a closer look at patient outcomes at 1 year versus 2 years. So these are for patients who stayed enrolled for at least 2 years. So starting with diabetes medication, you can see that even more medication was eliminated from 1 to 2 years. For A1C and weight, you'll notice just a slight increase between years 1 and 2. And so I want to put this into perspective. So first, losing just 5% of your body weight is considered beneficial for your health. So 12% at 2 years is way beyond that. And then a 0.9 unit decrease in A1C is actually similar to what they find in many studies of pharmaceutical approaches to treat diabetes. But in this case, we're getting that result while eliminating medication. And then second, the increase over time is an issue for any lifestyle change intervention, right? Like we've talked about, long-term change is hard. And this isn't just the case for lifestyle interventions, it actually applies to pharmaceutical treatments too. Because what happens is that people have a hard time sticking with taking their medication over time too. But when we compare the Virta treatment to studies of other lifestyle interventions, our participants' weight loss and A1C reduction was actually about 2 times that of the participants in the other lifestyle interventions at 2 years. So we were really thrilled by these results, and we think that they provide great evidence that long-term lifestyle change is possible with the right tools and support. So why is the Virta treatment so sustainable? So we believe it's a combination of things. Dr. Britt is going to go into more depth, but just to give you a preview, the first is our continuous remote care model, which provides continuous support and monitoring with individualized recommendations. We give our patients the tools and support needed to make lifestyle changes sustainable. For example, coaches working one-on-one with our patients to find their why and set actionable goals, and then giving them tailored feedback to help them progress. We also have a huge focus on quality of life at Virta. We help our patients find ways to make lifestyle changes that fit into their life and don't compromise quality of life. And we think our dietary treatment recommendations are helpful for that too, since we generally don't require calorie counting and we help our patients find foods that leave them feeling both full and satisfied. And then finally, we are committed to our patients' long-term success. We're always doing more research to figure out how to improve our treatment. So we will be continuing to help our patients keep up these lifestyle changes for the long run. Okay, that is all from me. So now we're gonna switch back to Dr. Britt, who will tell you more about what Virta is and what it would look like to be a patient.
Thank you, Dr. Adams. So Dr. Adams shared with you some pretty compelling information about our clinical trial, and in fact, the results we've achieved since then have only improved. So the employers that we're working with, we are able to show even better results because we've continued to tailor our treatment for each and every patient. So you'll see that as I walk through the patient experience in just a few minutes. So we know that our nutrition therapy is powerful because we are attacking the root cause of the disease. For those with type 2 diabetes or pre-diabetes, like Wilma here, who is an actual Virta patient, the problem lies in blood sugar control. Now, carbohydrates, things like breads, pasta, and rice, are the very foods that increase blood sugar. So learning what foods are right for you is key to managing blood sugar and therefore the disease. But change, as Dr. Adams mentioned, can be hard. Knowing what to do, how to do it, it requires a team for not only support and guidance, but for safety as well. We have demonstrated that we can do this and tailor it for any individual. And let me share with you how to begin. So you'll learn about the treatment like you are today, and then go to a specific link for your employer. And you'll receive that link after this webinar, so definitely be on the lookout for that. But as I mentioned, here is an email. If your question does not get answered today, you can email us at support@virtahealth.com. And before you get started in any part of this process, please know that for those who qualify, this treatment is completely covered by your employer. Now, once you do go to that link that you will receive in an email, you'll fill out some basic information to begin the no obligation enrollment process. You will immediately be provided with an enrollment advisor who is an actual person to guide you through the rest of the process and is there to answer any questions you may have. Now, after meeting your Virta provider for approval into the treatment, because we are a fully licensed medical practice, you will receive a starter kit with all of the tools you'll need for an entire year. And that means testing strips for blood sugar are also included. Our education really sets you up to know what to do. And that means that even before making any dietary or lifestyle changes, we'll ensure you have the right knowledge for a really strong start. And it doesn't stop there, because as you continue, you'll have access to our educational tools and resources every step of the way. You'll learn firsthand some of our key principles. You'll learn just how many carbohydrates your body can tolerate while maintaining and sustaining, reinforce that, your metabolic health. It's not just about reversing the condition, it's about sustaining it through lasting lifestyle changes. You'll learn, how to eat until you're satisfied. So not walking around hungry all day really makes lifestyle changes much easier. And if exercise isn't currently part of your routine, we don't require that you exercise in order to gain control of your metabolic health. It's great for a lot of reasons, but not necessarily needed when it comes to diabetes reversal. Now, as you implement the Virta nutrition and lifestyle changes, you and we are tracking how your body responds to the treatment by entering biomarkers, things like blood sugar and blood pressure, into the app. We, your care team, get that information in real time. And we're talking to you about how things are going, how you're feeling. Now, again, back to those biomarkers and messages that we're having with you, or that we're exchanging with you, our predictive algorithms can alert us, your care team, before you really need help. So we know when to make a medication change, when to reach out with added support because we haven't maybe heard from you in a while, when to suggest a nutrition modification, and we have specialty interventions to handle each of these. Now, we'll work with you and your existing providers to ensure that you get the best care to reverse diabetes. Now, a lot, of course, goes into diabetes reversal, but as Dr. Adams and I have mentioned, the right support is key to sustaining that reversal. This includes the one-on-one continued support from your care team, and that's your provider and really a team of coaches, as well as the support from our online community of other Virta patients. This is optional, but patients tell me all the time that the support and accountability they receive here at Virta is instrumental and life-changing. And again, we want to help you not only reverse your diabetes, but sustain that reversal for a lifetime. So I'll leave you with some key takeaways before Dr. Adams joins me again for a few minutes of questions. Now, some important points to leave you with is that, again, lifestyle changes can be hard, but they're not impossible. They are possible. We recognize this. Especially with the right nutrition recommendations and the science behind it, the right guidance, we can make those sustainable lifestyle changes happen. And it's not just about making the changes, but sustaining those changes. And in doing so, support is absolutely a critical component. We mentioned finding your why, but revisiting that often can be an important piece to these lasting changes. So we hope that today you've gotten a closer look at how we at Virta help to make sustainable lifestyle changes. And if you're interested in learning more, again, please be on the lookout for that email coming to you soon after this webinar. I'm going to bring Dr. Adams back and we are going together. If you would like to remain on the line for just a few more minutes, we have a few questions here that we'll answer. And again, we'll send a recording of this to you after the webinar. Okay, so can we enroll in the program if we do not have diabetes? I see the benefits of some, and had been diagnosed back in my 20s. I am currently age 61. I believe a diet limiting carbs with medical guidance has benefits in other areas as well. You are correct in that carbohydrate restriction is powerful in a variety of areas, not just in those with type 2 diabetes. Whether or not you will be covered would depend on your employer, so please look for that information, and we'll provide the criteria as well in terms of will this program or will this treatment be covered for you. So great question. This is another good question about our term reversal. So I understand not taking medication and but they are still needing to control blood sugar, and they're doing this with lifestyle changes. Absolutely. That is why actually what Dr. Adams shared with us today, and a lot of the things that we work on with our patients about making these habits stick, is so important. Because if a patient is unable to, of course, sustain all of these changes that we have worked on, you're right. The diabetes can come back, right? So our goal is to have a patient figure out with us what works for them in the long term. That doesn't mean every person is perfect, and that they don't have, as Dr. Adams mentioned, some slip-ups and lapses along the way, but those are all chances to learn how to make the lifestyle sustainable so that we can, in fact, keep the diabetes at a point where we can say you've reversed your diabetes. Dr. Adams, if you want to add anything there, please feel free. Otherwise, I'll get to the next question. Let's see. About a year ago, to qualify, you had to not only be an employee, but also on the employee health care plan. Is this still the case? So because we have a variety of individuals on the call today, we won't be able to answer employer-specific questions, but definitely please email support@virtahealth.com or go back through the enrollment process. At the very beginning, you should learn about who qualifies and who does not. So great questions, though, and thank you for your interest. Let's see. I am very interested in Virta. However, because our insurance is through my husband's employer, they're not letting me take part. Who do you work with here? And okay, so sorry, this is another employer specific. I'm trying to get to all of the questions. If you have an employer specific question, please contact us. We will get to each and every question, I promise, and we will figure out how to best answer your question. A lot of great questions about, do you have to have type 2 diabetes? So certainly wait for that email, but I will say this type of intervention is powerful for those with prediabetes, type 2 diabetes, obesity. I mean, the treatment really does work because we're targeting the root cause. Let's see. Aren't there some, this goes back to diabetes reversal, and thanks for the great questions. Dr. Adams and I are completely ready and willing to stay on the line for a bit longer. So aren't there some that do sustain all of the changes and still need medication? That's a great point. We cannot stand here today and say every single person will get off every single diabetes medication. We really do take into account a person's health, their history, how they're responding to the treatment. Some patients may need to remain on a certain medication. We will only remove medications as it's safe to do so. So certainly that's a fair point about medication. Why is this plan not for type 1 diabetes? So that's a really good question too. Fundamentally, the two disorders are a bit different, so the two diseases, and our treatment has really been designed for type 2 and prediabetes, but that does not mean it's not impactful. These nutrition changes are not impactful for those with type 1, but at Virta, at this time, we are not enrolling those with type 1. Okay, if employers don't sponsor the plan, if you don't qualify? Can an individual self-pay, or is this service only offered through employers? Absolutely. We have patients who pay directly out of pocket, so I would absolutely encourage you to go to virtahealth.com for more information on that. So just virtahealth.com, and we have some really great information about how you can apply and pay out of pocket. Going back very quickly to the type 1 question, will it be covered for type 1 in the future? I can never say definite yes or no either way. So I apologize. One can only hope that we can open it up in the future. But again, for the time being, we are not open to type 1 diabetes. So a little similar to what we've been saying, and I'm sorry for the rapid fire, but do you have to be diabetic or pre-diabetic in order to qualify? Can you just join because you like to live a healthier life and benefit from the lifestyle changes? Awesome question. Again, your employer may or may not cover depending on your diagnosis, and if your employer does not cover, but you would still like to apply for Virta and pay out of pocket, you can do so with us, and we do not require that you have the diagnosis of prediabetes or type 2 diabetes to be a Virta patient. Okay, why is metformin not really considered a diabetes medication, since that's usually the first medication given when first diagnosed? Completely understandable, but it is not only a medication prescribed for blood sugar control, so that's why we only categorize diabetes-specific medications when we're talking about reversal, because some patients may remain on metformin, and that's completely fine.
Yeah, we think that there are a lot of benefits for metformin, so we don't think it would be in all patients' best interest to take them off metformin just because their blood glucose is in control.
All right. Okay, if our A1C is already on the lower end, 6.5, and almost off insulin, would Virta still be beneficial? Most of the studies shown had patients with higher initial A1C, although a certain medication you would like to eliminate. So we do try to eliminate, we focus on your diabetes and the elimination of diabetes-specific medications. So we do not take over, primary care. This is a great chance for me to say that. We want to work with your existing providers to really be the specialists for type 2 diabetes. And that said, we have patients who range from all complexities of, pre-diabetes, taking very minimal medications, to a longstanding person with type 2 or person who has had type 2 diabetes perhaps for decades and is on hundreds of units of insulin. So it is not a one size fits all or a one sort of profile fits all for who can benefit from the treatment. So that was a long way of saying this can still benefit someone who has already seen some major improvements, and congratulations for getting to that point where you're at right now. Let's see, is there information for enrolling retirees? That again would have to be employer specific. So again, definitely email us. Okay, let's see. I'm gonna actually turn this one to you, Dr. Adams, because I think this goes into those long-standing changes. So what if my results are achieved in 6 months? Must I continue with the plan? Before I turn it over, I will say all of this is optional, so you never have to continue with the plan, but I'm gonna turn it over to Dr. Adams and let her give her input.
Are you talking about the plan? Are you talking about the Virta lifestyle plan? Or are we talking about continuing to set action plans?
Let's say continue with Virta in the first question, and then if you would like to follow up, whomever asked this question, you can provide more detail in after Dr. Adams gives her initial answer.
So we think that continuing to follow the Virta lifestyle plan is going to continue to benefit you even after you've seen improvements in your health. So that's kind of the short answer. I mean, there's nothing that you have to do, and what our coaches do is they work with you to try to figure out what the best ongoing lifestyle plan is to help maintain your health and just kind of meet your general goals for quality of life. For some people, that means that kind of the plan changes over time.
Absolutely. And what that might look like is some patients achieve reversal as early as, say, 70 days. Our published research shows that. Patients are able to sustain that reversal. But what it looks like to get to a point where they sustain it is very different, as Dr. Adams mentioned, for each person. Some patients really need to focus on improving their sleep quality in order to really sustain that reversal. Some people need to work on their stress levels. Some patients are working on these social environments where they're surrounded by food all the time. And even as often as patients achieve that early reversal, patients do achieve it at different times. Some patients at 6 months, some patients at 1 year, but we're working on those habits throughout the entire time. And it does change as your treatment changes and as time goes by, and it's just so individual. Let's see, if you self-pay, does this service qualify for FSA accounts? So we can plan to set aside monies for next year in annual enrollment if we want to self-pay. I believe the answer is yes, but I am not an enrollment specialist, and I would encourage you, unless Dr. Adams, you have the exact answer, I would encourage you to email support@virtahealth.com just to make sure, because I don't want you to leave here today with any of the wrong information from anything we're telling you.
Yeah, I would look into that individually. But I know we're working on trying to figure out how to make that easier for patients.
What is the average length of the treatment? So that's a really tough question. We actually ask for patients to commit to a year. That's why everything that we have set up in terms of your starter kit for the supplies are provided for a year, and that's what employers sign up for. So at least a year. And the reason for that is exactly what Dr. Adams talked about, making these habits stick. If you reverse your diabetes, say in 6 months, we don't want 3 months later to have that all revert back, right? And often the longer that you practice this lifestyle and you learn to implement this lifestyle, the more challenges you're actually faced with. Think about the course of a year for you. I think about my own year, and I think about holidays and gatherings with friends and just every possible, unfortunately, death in the family, someone becomes sick or ill, and we're working with our patients to maintain this lifestyle while dealing with these outside pressures, and committing to a year often gives people the chance to really learn how to do this for the long term. And a lot of patients, I will tell you, continue on for the next year if their employer pays for it, because they get that added support from the community, the ideas to kind of keep everything exciting. So many of our commercial patients continue on for longer than even that first year. And then beyond that, if I think to our clinical trial, our patients initially signed up for 2 years, and we decided we would extend the trial to 5 years, and many of our patients signed up to do that. And we're right now, this month, hitting the 4-year mark of that trial. Super exciting to think about that. So it really depends.
Stay tuned for more results.
Yeah. This is a good tactical question. So I have an older cell phone. What size data space will be required on my cell phone? Well, here's the thing. You can access our Virta app through your web browser on your computer, through a smartphone, or using the app from the Apple Store or the Play Store. And then also we can communicate with you through text messaging. So as long as you have access to the app through a computer and are willing to text message with us through SMS, then you should be okay. But again, that would be one of those enrollment questions that you'd want to ask and just clarify, just to make sure, specific to your specific cell phone, data plan, and all of that. Let me make sure, I'm just looking to my right here because I have the questions listed, and I just want to make sure I've gotten everything. Dr. Adams, double check me if you can see them. A lot of great eligibility questions. And again, check on the employer-specific criteria. Okay, I think we have everything. Thank you for those who stuck around 15 minutes after our scheduled time together. So we appreciate your interest. We really do hope to see you on the other side as Virta patients, because we really look forward to working with each of you in the Virta treatment. So thank you so
Thanks for
much.
listening.